All right, guys, we're continuing with our signs and symptoms. I've been trying to record this lecture, and I seem to keep on getting interrupted, so we're just going to go with the flow here. I got a lot of this information written, and I'll just explain it as we go along, okay? So we were on number 7. Again, patients taking corticosteroids, they're on some type of corticosteroid therapy. One of the problems that you'll run into is a decreased immune system. Now, we talked about how the corticosteroids have the property of causing an anti-inflammatory effect. So patients, for example, that have rheumatoid arthritis, corticosteroid therapy will be provided, or even arthritis. Okay, corticosteroids will, again, bring down that inflammation. But another effect that the corticosteroids have on the body is they cause, again, immunosuppression. And patients, for example, that have an autoimmune disease, again, an example of that would be rheumatoid arthritis. Another example of that would be something like lupus. That would be another example. Okay, lupus is another autoimmune disease. A corticosteroid therapy or a corticosteroid may be given. In that scenario, it is given to decrease the immune system. Another example would be somebody who had a heart transplant, an organ transplant. Again, these medications may be given in the reason being for, again, to suppress their immune system. Now, when you suppress a patient's immune system, you must be aware that the rate of infection, or the likelihood that this patient will suffer an infection, will increase drastically. So you always want to make sure that you look out for these patients. Make sure if you have a patient that is on contact precautions, you make sure that once you come out of that room, that you wash your hands very, very thoroughly. Because again, these patients are immunosuppressed. The other thing that you want to do for these patients is assess any open wound, any surgical site, and you assess it very, very carefully. You always assess for redness, for pus, because again, there's an open wound, they have a high risk of infection, and especially with a decreased immune system. So you always want to pay attention to the WBC. Is the WBC increasing? Again, that could lead to a sign, or that could be a sign of infection. Okay, so that was number 7. Number 8, mood disturbances. These medications have a very, very, very drastic effect on a patient's mood. So they could become angry, they could become hostile, depressed, suicidal. And again, these medications cause these mood disturbances. Make sure that you know this. You also want to tell your patient, if they are on some type of medication, some type of corticosteroid therapy medication, that they do not that they do not stop taking that medication abruptly, because again, it will cause severe mood disturbances. And we'll get a little bit into that when we talk about our interventions. Number 9, hypertension. Now, why hypertension? Well, if you remember our talk on aldosterone, if you're going to have increased amounts of aldosterone in your body, you're going to have increased sodium retention, you're going to have increased water retention. Both sodium and water are going to raise your blood pressure. So you want to be very, very careful and monitor these patients' blood pressure, because if you have something like 190 over 100, you want to report this to the physician immediately. Okay, so pay very close attention to blood pressure. Now, the diagnostics that you must know for the NCLEX exam, is number 1, plasma cortisol levels. Now, again, we're talking about Cushing's, therefore, cortisol levels will be increased. So you're going to look for increased plasma cortisol levels, number 1. And number 2, the big one, is this 24-hour urine collection test. Now, this is very specific to Cushing's. Again, it is a 24-hour urine collection test. If the patient misses any void, they must resume, or they must start the exam all over. So be very, very specific. Tell your patient, educate your patient that it must be a complete 24-hour urine collection. Now, normally the urine cortisol levels are between 80 to 120 micrograms. In Cushing's, however, again, the cortisol levels are elevated. So these levels are greater than 120 micrograms. Okay, so if you see this on the NCLEX and you see 24-hour urine collection test, boom, right away, you know, start thinking Cushing's, okay? Next thing you would look at is the level. Now, our interventions. Now, this is going to depend greatly on what is performed. If, for example, some type of surgical therapy is performed, or drug therapy. So why would you do surgical therapy? Well, remember that we talked in the very, very beginning about how this could be a pituitary tumor, maybe a lung tumor, pancreatic tumor, or maybe adrenal gland tumor. So in that case, surgery may be performed to remove the tumor. So that's number one. And here I have the transsphenoidal approach, and that would be if you're going to remove the pituitary gland. And we talked about this approach during our lecture on acromegaly, okay, the transsphenoidal approach. Number two, if surgery is not performed to remove whatever mass may be present, then you could also do drug therapy. Now, the two drugs that you may see is ketoconazole and aminoglutathione. Now, these may be given, and these will be given to decrease the corticosteroids or the cortisol levels in your body. The problem with these two medications is that they are very toxic. Number three, you may tell your patient to gradually discontinue medication. Now, if this medication is done for some type of inflammatory response, maybe you've been using your shoulder too much, or maybe you've been doing too many squats and your knee is swollen. You're a football player, you've been throwing the football too much. You have some type of inflammation. You go to the doctor and they give you prednisone. They give you a couple of pills. Typically, they will give you a set amount the first day, set amount second day, third day, fourth day. On the fifth, sixth, seventh day, you will be tapering off. You will gradually discontinue the medication, and so you must inform your patient to gradually discontinue medication. They should never abruptly stop taking the medication because it can cause a lot of problems. So you must inform your patient to taper off slowly. Okay. Number four, you will do a daily weight. Now, the reason you will do a daily weight is, again, because we talked about it just a little bit ago. You are retaining sodium, and you are retaining water because of aldosterone. If you're retaining sodium in the water, that is going to cause an increase in your blood pressure. But again, you're retaining water. So this will have an effect of increasing your weight. So again, you want to monitor that daily weight. You want to make sure that they aren't retaining too much fluid, because if they retain a lot of fluid, where is this going to go? It is going to go into the lungs. So again, you want to auscultate those lungs. Are there any crackles present? Are they having any difficulty breathing? Is their O2 saturation level, is that fine or not? Is that okay? Is that within normal limits? Number five, you're going to monitor for signs of infection, redness, discharge, pus, increased WBC, especially if they had surgery. Okay? Now, if they had the transsphenoidal approach, they have the likelihood of their skull being open, so that presents problems like meningitis. If they had their, for example, adrenal gland removed, remember that that's right on top of the kidneys, so they'll go in through the back. Well, that presents other problems, other forms of infection. You could present bacteria to the kidneys. You have some renal issues there. So again, you're always monitoring for signs of infection, and especially if they had some type of open wound. You're going to assess for chest pain. Why? Well, let's get back to our aldosterone. Remember, we said it's going to increase your sodium levels. It's going to increase the amount of water you retain, and as a result, you will have increased blood pressure. But also remember that aldosterone has an effect on potassium. And that effect is that potassium will be excreted. You will avoid that out. So your potassium levels are going to decrease, meaning you will become hypokalemic. Now, if the hypokalemia or the potassium drops to great amounts, you must monitor the heart. You'll get an EKG because again, you don't want to run into some dysrhythmias. So again, if your patient begins complaining of chest pain, make sure you listen to that patient and find out why. Number 7, we talked about how cortisol will increase blood glucose levels. So again, you're going to monitor. You're going to check for glucose levels. I said this before, maybe their diet may need modified. Maybe you'll put them on a diabetic diet. We'll do finger sticks, ACNHS before eating and before going to bed. Now again, this goes we're going to talk about a little bit of surgery here. If the patient is going to have surgery, you must make sure that their electrolyte level is within normal limits. Why? We talked about how they have the likelihood of having increased sodium levels and decreased potassium levels. So you have to make sure that these are within normal limits. And again, this is pre-op. You must also make sure that their sugar levels are within normal limits, because if they're very, very high, they will not be able to go to surgery. So again, you will report any of these to the physician immediately. Now, one thing that you need to know for your NCLEX exam is, for example, let's say that the adrenal glands are removed. One thing you must know is that the adrenal glands are highly vascularized. This means that they have a big amount of blood supply to them. So you have to make sure you monitor for bleeding. If they did have the adrenal glands removed, again, you have to monitor for bleeding. So again, you would assess that patient's blood pressure. Later on, you would assess hemoglobin and hematocrit. You will assess their skin color, their capillary refill. Again, check the blood pressure. Are there any severe changes? Again, you're going to check the electrolyte levels with focus on sodium and potassium. Now, right after surgery, you will administer corticosteroids. Prednisone, Solumedrol, Solucortef, whatever the physician prescribes. Because again, remember, in Cushing's you have a high amount of corticosteroids in your body. If you go and resect the adrenal gland or whatever the cause is, well, you're going to go from high amounts of corticosteroids to no corticosteroids. That will put your body into shock. Therefore, you must administer some type of corticosteroid therapy to, again, taper off that patient, or wean off that patient, or excuse me, wean that patient off the corticosteroids. Now, again, you're going to report any changes in blood pressure to the physician immediately. Again, you will monitor the wound site for signs and symptoms of infection, because, again, these patients are prone to infection. And, again, you will obtain urine samples. And you're going to test those for cortisol levels, just like we talked about before. With the 24-hour urine collection test, this is not going to be a 24-hour urine collection test. You're just going to do this, as the physician requests, because again, you resected the adrenal gland, you resected the problem, so you should expect those levels to, again, gradually come back down. Now, you must know that the time be 24 to 48 hours post-op. This is the critical period. Okay, so within these first to 2 days post-op, that is the most critical time for that patient. So again, make sure you monitor that patient very, very well. Make sure you pay very, very close attention to the wound site, to the blood pressure, and to their mood, make sure that they aren't having any mood swings. If so, that could mean possibly that you may have to give more more corticosteroid therapy.